Under 2-minute pathology, first today we'll discuss about hepatocellular carcinoma. Before that, we'll discuss hepatic tumors and its classification. It can be classified as benign or malignant variety. Under benign variety, first hepatocellular tumors, it is hepatocellular adenoma, whereas its malignant counterpart is hepatocellular carcinoma and hepatoblastoma, which is generally seen in children. Hepatoblastoma is seen in children. Now, under biliary tumors, the benign variety is cholangioma, whereas the malignant variety is cholangiocarcinoma. The benign variety of mesodermal tumor is hemangioma, whereas its malignant counterpart is angiosarcoma. Now we will move on to hepatocellular carcinoma. Hepatocellular carcinoma is the most common malignant tumor of liver, and when we discuss about the etiology, it is mainly related with cirrhosis and alcoholic liver disease. So the etiological factor or risk factors include alcoholic liver disease, non-alcoholic fatty liver disease, hepatitis B infection, hepatitis CE infection, aflatoxin B1 exposure. This aflatoxin B1 exposure, it causes p53 mutation, which is a tumor suppressor gene, hematochromatosis, alpha-1 antitrypsin deficiency, and the genetic factors include mutation in p53 gene, beta-catenin, and even we see KRAS mutation. Now if we look at the gross features, the hepatocellular carcinoma present in either of the three forms. It can be this unilocular form. Unilocular means it presents as a single mass. It may present as multiple mass, that is known as multifocal, or it can be widely disseminated. Widely it may be infiltrating, so it can be infiltrating form. So mainly it presents in three forms. So it is present grossly in any of the three forms. One is unifocal. Unifocal means single large mass. It may be multifocal, that is multiple and widely distributed nodules of variable size. It can be diffusely infiltrative, that means it is permeating widely and it involves the entire liver. If you look at the gross further, the tumor appearance, then as you can see the tumor here, it is yellow to tan in appearance. It is a soft mass with areas of hemorrhage and necrosis. As you can see here, this is the areas of hemorrhage, right? These are the areas of hemorrhage and necrosis. So it is yellow tan soft mass with areas of hemorrhage and necrosis. Under microscopically, these tumors may be well differentiated or highly anaplastic. Well differentiated means that the tumor cells, they exactly resemble the hepatocytes. So as they resemble the hepatocytes, the tumor cells, even they produce bile. So bile production is done by tumor cells, which is the hallmark of this tumor. Okay, hepatocellular carcinoma, you have to write this in the exam. So well differentiated form, they even produce bile, and this is the hallmark. Whereas highly anaplastic lesions, the cell are having marked anaplasia and they are pleomorphic. Cells are arranged in trabecular or acinar pattern, that is pseudoglandular pattern. Cells, if you look at the individual tumor cells, the nucleus is prominent. There is enlarged nucleus, right? So hyperchromatic nuclei and increased nucleocytoplasmic ratio. Vascular invasion may be present, that is it may invade the portal vein as well. So portal vein invasion may be present. So this is all about hepatocellular carcinoma.